right, so let's talk our blood gases. Okay, so we have two types of blood gases that we could pull. That's going to be the arterial blood gas, which comes from the arterial side, or venous blood gas that comes from the venous side. And we'll go kind of in depth ish with everything, and then back up and learn the quick method that I still use on post-it notes because it's nice and simple. So when we're looking at these, whether it's a VBG or ABG, it's going to look at the same things, right? So that's going to be our O2 content or oxygen content, the CO2, right, or carbon dioxide content, the HCO3 or bicarb content, and then finally the pH. So when we're looking at these two, it's going to be the two organ systems that we're really looking at are the lungs and the kidneys, because that's what our body is going to use to kind of buffer that pH and keep it where it needs to be. The way the respiratory side, right, or our kidneys, lungs, sorry, is able to compensate for this is by breathing faster or deeper, or slowing down, or making shallower breaths, right? And it's going to control that pH through CO2. Then we have what's called the metabolic side here, or the kidneys. Let me fix that there. And the way they control it is with bicarb, right? So the CO2 is a lot faster acting, but it doesn't work as well. The bicarb is slower acting, but works better, okay? Now, what winds up happening in the body is these interact with the water in your blood, right? So CO2 interacts with the water in the blood. And when it does that, it creates carbonic acid. Okay, so that increases the amount of hydrogen ions that are available. And because of that increase of hydrogen ions, the pH is going to drop. So what this means for you looking at these real quick is that if CO2 is going up, right? So we have increased CO2, then that's going to lead to decreased pH, okay? Or it's going to become more acidic. On the flip side, bicarb, which is a buffer, is going to reduce the amount of hydrogen ions. So whenever it goes up, okay, so HCO3 goes up, that's going to lead to an increased pH or more alkaline or basic. Okay. So our bicarb over here, okay, is going to make the blood more alkaline, right? Less acidic. The respiratory system, CO2, is going to make it more acidic. Now, these kind of work both together. So if one of them goes out of the whack, the other one's going to compensate for that. Okay. So if our respiratory system, let's say we're not breathing enough, okay, if we're not breathing enough, right, we're not exhaling, sorry, this carbon dioxide out of our lungs, right? What's going to happen is that carbon dioxide is going to build up in the blood. If it's building up in the blood, our CO2 levels are going to go up, right? So our serum CO2 is going to go up in the blood, which is going to result in just what's up here, which is going to bring down the pH. Okay. So our kidneys are going to see this, and our body's going to be like, hey, bro, and we'll put over here. So respiratory rate's going down, so that's going to increase our CO2. So the kidneys are going to be like, hey, bro, that's not what we need. Okay, so we need to start compensating for this. So once this goes outside of our range, the kidneys, okay, they're going to start releasing bicarb. Once they release the bicarb, it buffers everything. So what's going here is it's going to react, and the kidneys are going to release more bicarb, okay, to bring up the pH. Now this is slow acting, and what winds up happening is there's a little gap in between here, right? We don't want these things happening really, really suddenly, because it would just constantly be throwing everything out of whack. So there can be a little gap where what winds up happening is that pH is really, really low, and the kidneys, the bicarb, hasn't really had a chance to affect that yet. And then eventually the bicarb is released enough that it brings the pH down. And that's what we're talking about whenever you hear compensation in ABGs. And this can happen the flip side too, right? We could do the exact same equation the other way. If bicarb was going up for some reason, maybe we just gave them a whole bunch of bicarb, okay, then the respiratory rate is going to go down because the lungs realize that they need to compensate for this change in pH. what winds up happening if we're breathing really fast, okay, we'll run through a couple situations. Let's say we're breathing really, really fast. We're freaking out. Okay, we have test anxiety kicking in, right? Our respiratory rate is going up. What is that going to do to that CO2 level? Right, so if we're breathing really, really fast, that CO2, for all intents and purposes, just kind of think that like the same amount of CO2 is being breathed off every time, even though that's not entirely accurate. But it helps understanding these concepts here, right? So if we're breathing fast, we're going to give off more CO2. If we're giving off more CO2, that means there's less CO2 in the blood. Okay, so CO2 is going to drop. And what that's going to result in, since the CO2 is going down, pH is going to go up, right? Because we have less CO2, we have less of that carbonic acid. And remember, if CO2 is going up, that drops the pH, makes it more acidic. So right now, we're going to be something more alkaline. If that's more alkaline, our kidneys are going to see that, okay? And they're going to see the bicarb, and they're like, we need to drop that. We don't need as much bicarb, because we give more bicarb at the same levels of bicarb. That's going to increase that pH even more, make it more alkaline. Obviously, that's the problem. We don't want that. Okay, so how do we fix this, right? This is kind of the classic one where you give somebody a brown paper bag. They're having an anxiety attack. They get all lightheaded. They don't feel good because that pH is getting thrown off. So you give them a paper bag, and what that winds up doing is making them rebreathe the CO2. Okay, and by rebreathing the CO2 and bringing it back in, we balance out, okay, that pH level. That's what makes them feel better, right? And this can happen for a variety of different things, right? On the flip side of this, let's say somebody's got something else metabolic going on, okay? What if they haven't been taking their insulin? They haven't been taking their insulin, you have ketones build up. Okay, and these ketones, right, they're going to increase the acid. Okay, draw this the right way. And if they're increasing the acidity, they're dropping pH. Okay, so for this sake, that's a metabolic process, right? And then what's going to happen is the lungs are going to see this. And what are they going to do with the CO2? Well, they need to get rid of it, right? It's becoming more acidic, right? We don't want more CO2. We need to drop that CO2. And how are the lungs going to do this? They're going to do that by changing the respiratory rate. Just like over here, you're going to breathe hard and fast, okay? So it's going to be very shallow, very, very fast breaths. And then, so this all right here is being caused by a metabolic process, right? So these are the ketones and the acid and everything. So this is why somebody in DK or diabetic ketoacidosis, right? They breathe really fast. It's just their lungs trying to compensate for that. Okay. And then eventually you'll see the changes in bicarb, right? Those start happening just like above as the kidneys start to finally compensate for that. But the way they're going to compensate initially, and the biggest way they're going to try to compensate because it's a metabolic problem, is through the respiratory drive. Okay, the lungs are going to try to control it. Okay, so what about the normal values? So the normal values that we're going to worry about, we're going to start looking at. These might be tiny bit different at each hospital, but they're generally going to be around this same amount. Okay, so for pH, okay, that's going to be 7.35 to 7.45. Okay, CO2, you just copy these numbers right here, 35 to 45. Bicarb is going to be about 22 to 26. Okay. And then finally we have our O2, and this is going to depend on the type of sample that's being pulled, but we're going to say 80 to 100. Okay, so if we have any of these numbers that are outside the normal range, we have an issue of some sort. We need to figure out where that issue is coming from. So how do we figure that out? So there's a whole bunch of different methods that you look at this. We could go and step through that complicated kind of look of, oh, they're breathing fast, so maybe it's a CO2 thing. I'm going to show you a quick and easy chart method, and this is what I still use, you know, like on a post-it note, right? So all we do is just draw this down. Okay, and we're going to make kind of like a tic-tac-toe board. We're going to put the pH in the middle, put the CO2 on the left, bicarb on the right. Okay, so what we do is once we have our samples, right, we figure out where we're at, we just kind of draw arrows as to which way it is. All right, so if we look at the pH and it's normal, okay, we look at bicarb and it's normal, and CO2 is normal. So we just do a little hash mark like that. So we don't have any issues. Okay. But now let's say we had a pH of 7.0. Right, so we're outside that 7.35 to 7.45, and we're less than 7.35. Okay, so it's down. Okay, then let's say we look at the CO2. Okay, and it is, let's say, 60. So it's high. Okay, except in this case, because of it being high, it's actually low. And when we're doing these arrows, it's in reference to the pH. Okay, this is one of kind of wonky. It flips it around. It makes it backwards thinking, but it'll make sense in the end. Okay, this is the one that's going to trip you up right here. Now for bicarb, we're going to say that that is 24, right? Right in the dead set of normal. So the one that's flexing the most off, okay, so in this case, the CO2 is the one that's off, is where we're going to have that issue. Okay, so in this case, we have a CO2 issue. So we say it's a respiratory issue. Right, so it's a respiratory. Then we look at the pH, right? In this case, it's acidic. So it's respiratory acidosis. Then we go to the bicarb and we see if anything's going on there. We see there's no change yet. So the kidneys have not yet compensated. So there is no, so we do our little annotation. So the with right there is that C with the line, with no compensation. Right? There hasn't been a change yet. Now, if we see a change, that's where we have a partial compensation or full compensation. So how do we figure that out? All right, so let's do another one. So let's say, in this case, our pH is now 7.6. Okay, so we look at that, and we say that it's alkalotic, right? We're alkaline, so we're going to have that little up arrow at the pH. And then we look at the CO2, and let's say it is 40. So that is normal. And then the bicarb, okay, is 40 as well. That's high, right? So in this case, these two arrows match up. So this is around the bicarb side. We are metabolic. And look at the pH. We are alkalotic, so alkalosis. And then with, so the CO2 is still normal. No compensation. Okay. And let's try another one. Okay, let's say now the pH is 7.0. So in this case, we are down, or we're acidic. And then our CO2 is 60. Right? Remember, this one gets flipped. Okay, so even though it is up, it's actually down because it's becoming more acidic. And then our bicarb, okay, let's do 40. So it's up, it's going to follow because it's becoming more alkaline. Now we have a couple different arrows going in different directions, right? These still match up right here. So since it's CO2, we still have respiratory. And we see this is down, so we're acidic, so we're respiratory acidosis. With, in this case, bicarb has been thrown off here, right? It started going up. So now we have partial compensation. So what's happened is the kidneys have finally reacted, and they're starting to increase the bicarb in the blood to compensate for that CO2 buildup. Okay. Same reason we give bicarb in a code. If somebody's not breathing, they've been down for a while, and that CO2 is building up in their blood. A lot of intensivists, despite kind of evidence here, will give bicarb to compensate for that pH, to get the body through, just to be able to be stable until it can correct itself. Now we'll do one last one here. Okay, so in this case, we're going to say the pH is 7.42. So that's actually normal, right? And then we'll look at the CO2. We'll use those same numbers from last time. So let's say it's 60, so it's down. And the bicarb is, let's do 40 again, so it is up. Now, at this point, because we don't have an arrow, we can't really match this up. So what we do is we draw a line down the middle, okay, from the 7.35 to 7.45, right? So that's going to be 7.4 is that line right in the middle. In this case, we're 7.42, so we're just on the other side of that. So we're going to treat the pH as an up arrow in this case. So now we just match these lines up again, right? The arrows. So we have metabolic, okay, because it's matching on this side. And we have alkalosis. And that's even though we're normal, okay, the CO2 is abnormal and the bicarb is abnormal. So we're metabolic alkalosis with, in this case, full compensation. Because what has happened is that we've been sitting at that level for however long, or the lungs are just not breathing anymore for whatever reason. And it's gotten to the point of being able to compensate fully for the kidneys being out of whack, right? Because this number is so off, the lungs have just decreased their respiratory rate, right? Enough to bring the pH to a level that's normal. And that's when we're talking about full compensation, is when the pH is normalized, but both of our lab values of the bicarb and CO2 are still pretty wildly off, right? Until one of those things is fixed, we're going to be at that point where those values have to be greater than or less than they're supposed to be to compensate for the other one that's messed up. So let's try one more. Okay, I'll write some lab values down here. So we'll do a pH of 7.2, do a CO2 of 55, and then a bicarb of 28. Okay. So you can take a second, look at this, try to figure out where you think we are. All right. So we look at the pH. We see that it is down or acidic. So we already say we are in acidosis. Okay. We look at the CO2 and we see that it is up. Remember, this arrow gets flipped. So even though it's up, it's actually down. Then we look at the bicarb and we're just outside that 22 to 26. But we're possibly normal depending on the hospital. But for all intents and purposes, this is going to be on the high side, right? So in this case, we look at these two arrows. We see that they match up on the CO2 side. That's going to be respiratory acidosis. And because the bicarb has slightly changed, we see that it is partial compensation. Because the bicarb has not changed enough yet to level out the pH. Okay. So hopefully that helps explain a bit more, make things make a bit more sense. Again, this is the way I do this on a post-it note. Just about every time I get an ABG, I have to do an ABG analysis or anything. And then you can go further into this as far as bringing in, hypoxemia. And that is just talking about the CO2 level, right? If it's outside that 80 to 100. If you're under 80, you have hypoxic. If you're not, then you're not hypoxic. But hopefully that makes things make a bit more sense. Use that in practice, use that in school.